Great. Well, thank you everyone for joining the Commonwealth Fund Fellowship in Minority Health Policy at Harvard University informational webinar. I'm really excited that you all are here to join us today. It's just such an important time, and this is really just a special and amazing fellowship program. And before we start, I'd like to just talk through some housekeeping just for all of you on the line. The slides and the recording of this webinar will be available after the webinar. All lines are muted, and so if you have questions, please submit them through the webinar in the Q&A box or the chat box, and we will answer them. We will answer them either at the end or throughout if it fits into the conversation as well. But we're looking forward to answering all of your questions. If we go to the next slide. Just for the agenda, I am Dr. Lori Zephyrin at the Commonwealth Fund. I'm Vice President Delivery System Reform. I'll just be providing a brief introduction, and then Dr. Joan Reed, who designed and leads the fellowship, will be providing an overview of the fellowship. And then you'll be able to hear from several amazing alumni who'll be able to talk about their experiences and what they've gained from the fellowship and the fellowship camaraderie that they experience, and just the impact of all the fellows over the last couple of decades. We'll see Dr. Corinne Davila, Dr. Alden Laundrie, and Dr. Mary Fleming. And then we'll have an opportunity for Q&A. Great. So just briefly about the Commonwealth Fund. Commonwealth Fund has supported this fellowship for over 20 years. And the Commonwealth Fund has been around for about 100 years. And the Commonwealth Fund was the first foundation led by a woman. And really the mission of the Commonwealth Fund is to promote a high-performing healthcare system that achieves better access, improved quality, and greater efficiency, and really focusing in on society's most vulnerable, really those most vulnerable to inequity. There's several areas of focus at the Commonwealth Fund, and in the Delivery System and Reform program, I lead the vulnerable populations work and the work relating to advancing health equity at the Commonwealth Fund. And really very core to that work and our mission is to advance diverse leadership. It's really important to build leadership and build diverse leadership across healthcare. And if you go to the next slide, and when we think about why it's important to advance diverse leadership, we just see a lot of reports and information today about just the need for diverse leadership in healthcare and in health policy and how that can impact outcomes. There's a need to improve healthcare delivery for people vulnerable to inequity. There's really an importance for diverse conversations and diverse mindsets at the table as policy is being designed. And there's also a need to increase the dedication of health systems to improving health equity with a focus on justice, and really also an importance to be able to foster health system change and create healthier, more equitable communities. And ultimately, through advancing diverse leadership, that's really an important component of advancing health equity. And really the Commonwealth Fund Fellowship in Minority Health Policy at Harvard, just the curriculum and the design and how Dr. Reed and her team have really invested significantly in this fellowship really is not only just creating a cohort of leaders that can do all of these things, but really also have a mind towards advancing health equity and advancing justice. And if you go to the next slide, all of you are very familiar. We're in the midst of a pandemic, and the world is awakening, and our country is awakening just to the impact of societal and health inequities. This is just some of the work that we've done at the Commonwealth Fund, really just showing the impact of COVID-19 on Black and Latino communities, on the mental health impact on women as well because of the pandemic. And so it's really important that we're seeing an awakening of society to the importance of addressing systemic racism, of addressing societal and health inequities, of addressing justice in healthcare. And really, this is an amazing opportunity and an amazing fellowship that can help provide not only the foundation, but also the training and just the combined expertise of a number of leaders to really help shape the healthcare system. And I really believe that this fellowship is doing that already, and the people that have completed this fellowship are already doing that. If we go to the next slide, just for today's speakers, I'd like to turn it over to Dr. Reed in a minute. And Dr. Reed is the Dean for Diversity, Inclusion, and Community Partnership, Professor of Medicine, and Program Director of this Commonwealth Fund Fellowship in Minority Health Policy at Harvard University. And as I mentioned, you'll hear from current Commonwealth Fund Fellow, Dr. Karine Davila, and then you'll also hear from two alums, amazing alums, Dr. Mary Fleming, who's an OBGYN and president of the Reed Scholars, and also Dr. Alden Laundrie, who's assistant dean in office at the Office for Diversity, Inclusion, and Community Partnership, and helps also lead this fellowship program as well. So I'll turn it over to Dr. Reed, and really excited you all are with us today.
Thank you. Thank you very much, Dr. Zephyrin. A little bit about the goals of the fellowship. The fellowship has been around for more than 20 years, as it has been mentioned. And in many ways, the goals have remained the same. And Dr. Zephyrin has talked about why these goals are so important and remain important. Is to prepare physicians, particularly physicians from groups underrepresented in medicine, to become leaders who improve the health of all, but particularly for disadvantaged and vulnerable populations, and work towards transforming the healthcare delivery system, which also means that they can work in multiple places, which relates to goal 2. So it's not just to train individuals, but to train individuals who will move into positions across multiple sectors, from government to private sector, from health delivery agencies and academic medical centers to medical schools and professional associations. So it's positioning themselves in places where they can make a difference and create change. And the third part is this understanding that through the fellowship and identifying these talented individuals, nurturing those individuals, helping them get into positions where they can make a difference, that's not the end of their career development. And so how do we help ensure that individuals who go through this program continue to develop in their career, to continue to advance and continue to move towards positions where they can make a difference? Next slide. If we look over the years of the fellowship from 1996, there have been over 140 individuals who've come through this fellowship program. It's sort of this fellowship family of the Commonwealth Fellowship Program, but others who've come through the California Endowment and are still coming through the Joseph Henry Oral Health Fellowship Program come together as a family of change agents. You can see on this slide that many of these individuals remain in the academy or private sector, but some are in government. And I'll share a little bit with you later about the kinds of positions in government. All remain committed to vulnerable populations and improving the healthcare system. They serve on boards and committees and task forces, or in leadership positions, have awards and honors, and publish, and come from multiple disciplines. You see here from internal medicine to peds to OB to surgery to emergency, really across the board, the full spectrum. Next slide. In thinking about applying to the fellowship, what are the eligibility criteria? And it begins with being a physician, a board certified or board eligible physician, which means that residency has to have been completed, requires US citizenship or US permanent residency, and we're looking for evidence of leadership experience and potential. And clearly with this, a commitment to vulnerable populations, to making a difference with vulnerable populations and those who live on the margins. Benefits include a $60,000 stipend, full tuition to the Harvard Chan School of Public Health or the Harvard Kennedy School of Government, health insurance, books, travel, and related program expenses. And I'll tell you more about some of the travel and programming. but also financial assistance for a practicum project where individuals in the master's programs are required to do a practicum, but the fellowship also requires a practicum. It's one practicum for both. And then I think what you'll hear from some of the alums is this network of fellows. It's this family and this network of individuals within the fellowship and broader network of individuals that serve as a backbone and a support for people's careers. Next slide. In terms of some of the offerings, I mentioned that the degrees are through the Kennedy School and of Government and the Chan School of Public Health. At the Chan School of Public Health, it's an MPH in either health management or health policy. And at the Kennedy School, it is a Master's in Public Administration. There is cross-registration, so if you're, say, in the MPH program at the School of Public Health, you can take courses at the Kennedy School or the Ed School, the other faculties of Harvard. And here you see the key course requirements, the course requirements that go along with an MPH degree. And so fellows complete these core requirements, but along with these and embedded in these are requirements for the fellowship that are really focused on leadership issues and issues of systems, health systems and health system change, and issues of minority health and health of vulnerable populations. Next slide. And I said there's a lot of supporting and surrounding activities from leadership forums with key leaders from across the country, special sessions on skill development, a seminar series that's a course on minority health policy and leadership in minority health policy, journal club, book club. I mentioned the practicum before, where the practicum project that fellows fulfills the requirements for both the fellowship and for their Master's of Public Health degree. There's mentoring on multiple levels, mentoring from members of our office in the fellowship program that you see here, but also mentoring from alumni fellows, from faculty, from advisors from the fellowship, individuals who are in the specific disciplines, say somebody in pediatrics or OBGYN or surgery, but also individuals who are in health systems who can help guide and advise, and individuals who themselves come from groups that are marginalized. And so how can you start to learn from leaders who look like you, sound like you, may have traveled some of the same course? There are national conferences that fellows attend, not this year because of COVID, but historically in person. We are doing things virtually at present. There's shadowing of leaders. There's opportunities to have real world experience and join leaders within our Harvard affiliated hospitals, particularly Massachusetts General Hospital, and join them in seeing how work is done in action on the ground, how you move agendas forward. There's site visits nationally and locally, and as I said, they're being done virtually this year. And then there's an annual minority health policy meeting where current fellows join together with alumni fellows, in a truly exciting event. Next slide. So as you have this sort of didactics and the learning that comes with the degree and the courses that are mentioned and these supplemental activities and supports that are in place, part of what's happening during the course of the fellowship is for individuals to identify and build their own personal narrative, their own story and their own direction, expanding of career networks within and across the fellowship, but beyond that. Finding ways to foster better understanding of systems and how systems either foster or inhibit our advancing towards equity. Connecting with leaders and leaders in policy from multiple sectors, and strengthening alumni connections. Next slide. So the deadline for this fellowship is December 1st, 2020, and it requires applications, 2 applications, one to the Commonwealth Fund Fellowship and Minority Health Policy at Harvard University, and a second application either to the master's program at the Harvard Chan School of Public Health or the Master's Public Administration program at the Harvard Kennedy School. In order to meet the requirements for the fellowship and the Kennedy School, those are for individuals who already have an MPH from elsewhere. And you see here both the information for how to apply online, as well as if you have questions, you can submit them by email or actually call our fellowship office. Next slide. So these are the current fellows, and you'll see 8 individuals, 2 are oral health fellows, And our fellows come together and sort of cross disciplines, learn from each other across the board. You see multiple disciplines represented: internal medicine, OBGYN, pediatrics, but even in internal medicine, you see infectious disease, you see palliative care, you see pulmonary. So really across the board in terms of the kinds of interests and backgrounds that the fellows have, what unites them is this commitment to being change agents around minority health, health disparities, health of vulnerable populations. And where do they go? The next slide. Here are some examples. And you see again this idea that they're in public sector, they're in private sector. They move towards leadership positions. And so you see Joe Betancourt, who's Vice President, Chief Equity and Inclusion Officer at Partners Mass General Hospital, and who started the Disparity Solutions Center and an associate professor at Harvard. You see Alice Chen, who is a professor at UCSF, but also Deputy Secretary for Policy and Planning and Director of Clinical Affairs for the California Health and Human Services. Michaela Cook, who's Executive Director of PCORI, the Patient-Centered Outcomes Research Institute. Monica Burrell, who's Commissioner for the Massachusetts Department of Public Health. Nawal Noor, who's Chair of the Department of OBGYN at Brigham and Women's Hospital. She began the first African Women's Health Center in the country and still runs that, and an Associate Professor at Harvard. Ross Jones, who's Medical Director, Total Care Group and Medical Director of Community Health in Jacksonville, Florida, at the University of Florida. Don Warren, who directs the Indian into Medicine program and Director of Public Health program and Associate Dean at the University of North Dakota School of Medicine and Health Sciences. And LaQuandra Nesbitt, who's Director of the DC Department of Health. So you see at the federal government level, the state, the city and county level, across the board for our fellows. You see them in the academy. You see them moving into leadership positions in community health centers and health system settings. So really across the board in terms of where the fellows go with their careers. Next slide. And so now I'm going to turn this to our current fellows and our alumni fellows. And I want to turn this over to Dr. Divya.
Thank you so much, Dr. Reed. So next slide, please. So first of all, I just wanted to say I'm really excited to be with all of you here today, and remembering how just 1 year ago I was in your shoes, tuning into this very webinar long before Zoom meetings and webinars were the norm. But I wanted to share that, creating bonds during this fellowship year has been different than years past, just in the way that our world is different than years past. But I think some things don't change. Somehow, Dr. Reed, Dr. Landry, and the Fellowship Selection Committee really select and bring together a group of amazing fellows every single year. I am in awe. Dr. Reed described a little bit of my co-fellows, but I'm really in awe of them and their accomplishments, all from different backgrounds and experiences, but unified in our common purpose to tackle issues in health equity and health disparities. So here you can see with a couple of the social events that I've been able to gather with some of my co-fellows, and our fellow cohort this year is quite unique. We're a group of 8 women of color, which is powerful into and of itself, and unlike any group that I've had a chance to be a part of, and I'm really excited to kind of join this group and join the family. Next slide. One of the things that Dr. Reed also highlighted was kind of how important, and I've already seeing this kind of a quarter of the way into my fellowship, is how important mentorship is and how it really comes at a lot of different levels. So I would say first and foremost, kind of your inner cohort is your cohort of co-fellows. So my 7 co-fellows teach me a lot, and sometimes more than kind of even what I'm learning in classes and hearing their different perspective on a lot of issues. The next layer is the alumni fellows, who, as you can see, we're kind of joining the family and who are really eager to give back and serve in these mentorship roles for us, both formally and informally. Then next you have another layer of the more formal program leadership through Dr. Reed and Dr. Landry. Then in addition to that, we have formal fellowship mentors through the Fellowship Advisory Committee, which, as we were getting the list earlier in the year and reading through, you have a very star-studded cast, and to know that we have the opportunity to get to know them on a close level and really create that connection is very meaningful. Next, we also get to connect with hospital leaders through the nuts and bolts curriculum and really get a sense of what does hands-on leadership look like when you go to the table. How do decisions get made? How do policies get pushed forward on an institution level? One of the other things is that an important distinction is this year is a lot about kind of your own growth and learning opportunities as a fellow, but it's also an opportunity to give back to those kind of coming behind you, who you're forging paths and ways for as well. So much like we have learned continuously from our experiences and mentors in our own journey, we are encouraged and given opportunities to then become a mentor to other students in the medicine and science pipeline, ranging from high school, undergraduate, residents, and the affiliated hospitals. Next slide. And then the last piece that I wanted to touch about is really how much we're getting really kind of hands-on leadership development, which is one of the main things that I wanted to get out of this fellowship, is getting a sense how do things happen and how do we learn how to become a better, more effective leader in the future. And I think my co-fellows and I are already leaders in our respective fields and hope and want to continue making a difference in our future roles. So one of the more formal ways is through the Leadership and Minority Health Seminar, which is a seminar run by Dr. Landry and Dr. Reed. And they invite a wonderful cohort of leaders in minority health to speak to us in a very kind of intimate Zoom environment this year, but to get a chance to really hear from them about their experiences, what's been challenging, what opportunities, and what have they learned from their experiences that we can kind of in turn learn as well. There's also some formal leadership training on both the MPH curriculum side. You take Strengths Finders assessment. We just had a session yesterday evening kind of exploring our own strengths and reflecting about how that can influence how we can become better leaders. And then we also have small group sessions. This is just within the Commonwealth Fund Fellowship with leaders like Professor Bill Kahn, Professor of Organizational Behavior from the Boston University School of Business. I alluded to this nuts and bolts hands-on curriculum. And so this is an opportunity where we have really, the fellowship continuously takes feedback. And so this is a new iteration this year where we have a chance to partner with one of the hospital leaders at Massachusetts General Hospital, in my case, and get a chance to participate and kind of join them on one of their standing committee meetings. What does that look like? How do they prepare and how do they help move things forward in a positive direction through that experience? And finally, our practicum project is a critical experience to the fellowship, not only on the MPH side, but also the Commonwealth Fund Fellowship side. And so where I am in my journey has been talking to a lot of folks, thinking about potential projects and really getting feedback, honing, refining, and learning from the different connections. You know, when I went to Dr. Reed and said, you know, here are a few ideas, she immediately was like, have you talked to this person? Have you talked to this person? Have you talked to this person? And so it's a really wonderful way to kind of stay connected and get connected to the people who are making a difference in this space. So all in all, to share, I'm incredibly excited to be part of this community, to be part of this fellowship that I know I will stay connected with for years to come. So now I'd like to have the opportunity to turn the mic over to Dr. Alden Landry next.
Thank you, Dr. Davia. It is a pleasure to join this webinar with all of the wonderful panelists that are speaking, as well as to be in attendance with everyone here who was interested in our fellowship. I just want to give a small reminder that the Q&A session is available and open. So if you have any questions that you would like to ask later on, we will try and answer as many of those questions live or replying to those questions as we go through our conversation. I'm going to keep my comments brief. I've had the pleasure of being affiliated with the fellowship for about 11 years now, both as a participant in the fellowship in 2009 and 2010, as well as serving in a leadership role within the fellowship, both in the leadership and minority health policy course, as well as working closely with Dr. Reed and the rest of the team as we bring on new cohorts of fellows each year. It's been an amazing experience for me. And I think part of the reason why I'm still in this space is because I recognize the value of mentorship in this space. And one of the things that you heard both from Dr. Reed and Dr. Davia is that mentorship is a key component of this fellowship. One of the things that many individuals who are coming from disadvantaged background, underrepresented medicine, physicians often experience is that lack of true strong mentorship to support them as they advance their careers. And oftentimes, many times we make missteps in our careers because we don't have those individuals that are there to support us. And one of the things that I benefited most from this fellowship was that strong mentorship that was established for me. I can give you specific examples of interactions I've had with alumni of the fellowship who came before me, who helped pave the way for me, both applying to this fellowship, being successful during the fellowship, and even building on for my career after the fellowship. Dr. Reed mentioned Dr. Joe Betancourt, who is an alum of the fellowship. He was actually one of the first few classes of the fellowship. And I met him because I had an interest in this space around health equity and workforce diversity. And he helped me at an early stage to cultivate my interest and also cultivate my application for my fellowship. One key thing that he told me very early on is what you get from this experience within the fellowship over the course of the year is what it typically takes an individual 10 or 15 years to do so on their own. And I took that and I looked at that advice that he was offering me and I said, well, this is an opportunity that I should definitely consider. And one of the things that I appreciate about the alumni fellows that serve as mentors is once they get you in the door and you're a part of the fellowship team, you're immediately supported, whether that is opportunities to look for the next steps in your career with job opportunities, trying to negotiate tough personal and professional situations, or whatever it may be that may be a barrier to your career growth and advancement. And so with that, having recognized how important that part of my career was and during this time during the fellowship, I felt as if one way I can continue to give back to underrepresented in medicine physicians, as well as individuals who are doing this fellowship, is to be in a role similar to the way the other fellows have been and to be of a support. And I'm thankful to Dr. Reed for the opportunity to continue to be here and give back to the fellowship. My role is a little different compared to other individuals who held a similar role to this, in that I get to work very closely with the fellows, even though it's virtually through Zoom. I have a unique opportunity to get them to know their careers and help them to shape out both those short and medium term goals. And I think Dr. Reed does a fantastic job of helping with that long-term perspective of career advancement. And the other thing I like to say about those individuals, for you all interested in this fellowship, when you are hearing from these individuals and you're thinking about what this may do for you from a career perspective, look at that list of individuals that Dr. Reed put up and where they're at from their career, but then also look at the other individuals who have done this fellowship and see where they're at. And I think you'll see an amazing cadre of individuals who are impacting health equity from a policy perspective at various stages, whether it be within their hospitals, whether it be at a state or local level, or even on a federal level, or in the nonprofit space. And so with that, I'll maybe pause in the interest of time, and I will turn the mic over to Dr. Mary Fleming, and she will speak about her experiences with the fellowship.
Hello and good afternoon. Thank you to all the other panelists, and thank you for our listeners for joining us today. I think it's only fitting that I follow Dr. Landry in this conversation, in that he was the first person I called when I learned about the fellowship, because he was actively in the fellowship, and the first thing he said is, you got to do it. And this fellowship has been a family atmosphere ever since. So I had the opportunity to, when I was coming to look for apartments, actually, I came during the annual meeting. And during the annual meeting, there is an annual health equity symposium that the alumni, the Reed Scholars, host every year. And I was able to catch the end of the symposium and stay for the reception. And everyone that I met that night said, this is going to be the best year of your life. And, you know, that's something that is a huge statement right now. Like, it's going to be the best year of my life. And I honestly say it was a wonderful year, definitely the best year of my life. And I would do the fellowship over again if I could. It was so much for me and in not just leadership development, but also personal development. And as a person who is an introvert by nature and can sometimes lack confidence, it was a very inviting and welcoming community. We are definitely a family. And that first day when I was kind of standing in the back, multiple fellows came over, introduced themselves, and invited me in before I was even in the fellowship. And so I appreciated that. And it was just the beginning. You can go to the next slide. So you've heard this kind of echoed over and over again, that we're not just classmates, we are definitely a family. And we find a way to hang out, even virtually or even in time of the pandemic, as you've seen before. But my classmates, this is a testament that we didn't hang out just in class. We didn't hang out when we were just doing didactic sessions or the scheduled sessions from the fellowship. We bonded quickly. We hung out outside of the fellowship just as much, or outside of the classroom just as much as we did while we were doing our coursework. We studied together. We picked each other up and held each other's hand when we were struggling with biostats. And so it's definitely a unique space where you're in a community with like-minded people who want you to succeed. And it's one of the few places that I think you'll have that type of community where you can have the same conversations during the day that you can have after hours at dinner. And it was just as comfortable wherever you are. Next slide for me. So you've also heard of where we go next. So, this gives you the confidence to move on to whatever you want to do in the next step of your career. In the leadership development is remarkable. It's not like anything else I could have experienced. And I think the other fellows will say the same. You've mentioned from Dr. Landry and Dr. Reed that the fellows go on to do all the things. So you don't have to feel forced into a box. I think the other unique thing about the fellowship is this is not trying to make you one thing. This fellowship is about finding what's the best in you and helping you to be better. And so they help you craft the career that you want in order to have the most impact on the vulnerable populations that is the most interest to you. So don't feel like, if you don't see somebody who exactly looks like you on our list, it doesn't matter. If your mission is about health equity, if your mission is about making a difference in the lives of vulnerable communities, this is the fellowship for you, because we will find a way to help you achieve your goals. You can do the next slide for me. And so, as I mentioned, the fellowship doesn't stop at the end of the year. And so, like I said, before I was even in the fellowship, I felt like I was part of the family. And when I left after the year, I knew I had to continue to be involved, like Dr. Landry said as well. And so, at the end of my first year, I started on the Health Equity Symposium because that was my first introduction to Reed Scholars, and that's how I decided to be involved. So the Reed Scholars is, in addition to the Commonwealth Fund Fellowship alumni, it is also the alumni of the other fellowships that Dr. Reed directs, and obviously our organization is named after Dr. Reed as well. So we are composed of both the physician and dentist that are graduates from her multiple fellowship programs. We are a nonprofit, and our annual event is still the Health Equity Symposium that we host every year. This year was virtual, and we'll have to stay tuned and see how we'll do it next year. In addition, we have an annual leadership retreat. Of course, we have business meetings that happen throughout the year, and then we have biannual or twice a year board meetings as well. And our mission is to continue to work on the health equity conversation together. So this is a collaborative effort. So some of it includes just providing support as we are transitioning in our individual careers. Sometimes we need to lean on others in our network. And so we will we have conversations virtually, but I will also say that sometimes I need to talk to someone on the phone, and we'll call each other up. And it's one of those things, if another Reed Scholar calls you, you're going to answer the phone. If another Reed Scholar emails you, they will email you back. So this is a family, and we will help each other if we need to transition, if we're looking for a new job, if we're having just trouble, honestly, at the job that we are currently in. So we help support each other, we network with each other, and then we also have collaborative efforts to promote health equity in general. One of those new efforts is a podcast that we've been doing for the past year almost, called Read Scholars Live. And so we talk about different topics around health equity each week. And the goal is to help people understand that health equity is not just the healthcare you receive in the confines of four walls in the hospital or clinic setting, that we have to continue to talk about social determinants of health, et cetera, around things that we can do as individuals, as groups, as communities, as leaders to change the health outcomes for vulnerable populations in this country. So I hope we have been informative. I hope that you have understood that this is a family, and we look forward to inviting you into our family to support you on the rest of your career goals. So with that, I will pass it back over to Dr. Reed.
Thank you very much. We're going to come to the Q&A, but before then, here is our website, cff.hms.harvard.edu. But we also have a video clip of our fellows, some of our fellows, talking more about their experience. We've been collecting some of the questions that have been coming in, and as soon as this video clip is over, we'll also put in the chat for everyone so that you can actually have the link for the clip if you'd like to look at it again later. You can get it from that chat link, but we'll show you the clip. We'll come back for Q&A, and at the end there's going to be some, don't see the video, and so instead you can pick it up from the link. I thought we were going to be able to show it now. Instead, we're going to start with the Q&A, and I'm going to take some of them, but I want to then turn it over to those who are on the call. And one of the questions that's come through about, is this full-time or part-time, and can you do clinical work? This is a full-time fellowship, and not part-time. There have been exceptions or times when individuals have done it over 2 years as part-time. But one is an example when someone was pregnant with twins and we had to space it out. But normally it is a 1-year fellowship. That is the norm. We don't recommend doing clinical time, but sometimes fellows do some clinical. And so I'm going to have them speak to if they themselves did some clinical or they know of others. Sometimes they moonlight. Sometimes they do some sessions in the hospital. Sometimes it's because we partner with other programs, and so they're fulfilling the Commonwealth Fellowship while they're also fulfilling some other obligations, and they do some clinical. So I'm going to actually turn that over to the three panelists to sort of talk about their experience in terms of themselves or others in terms of doing some clinical time and how they made this work. It's not overwhelming, but it is a full-time program. So Corinne, why don't we start with you and then maybe Alden?
Sure, absolutely. So this year, so I had recently completed my palliative care clinical fellowship and kind of wanted to maintain some ties to Massachusetts General Hospital, where I had a clinical footprint. And so kind of working with my division chief, working with Dr. Reed, we kind of came up with an agreement to really maintain only just a very small clinical footprint, and to continue being able to do some work, but doing it kind of around the fellowship. So for me, that means kind of, working more weekends than your average person might do, or kind of, finding 1 week stretches, in June, like towards the tail end of the fellowship after you've actually already finished your MPH curriculum and things like that. So it, fortunately, kind of in my division, you can be somewhat modular with your work. And so everyone's been really good at working with me to kind of find the dates and times that work around all of my fellowship obligations. Because as Dr. Reed mentioned, they are extensive, and that's the richness of this year. So I think it really means kind of taking the year to delve deep into this.
Thank you, Alden. Maybe you can sort of share some of what you've seen, both as a fellow and now as you've been sort of co-director.
So I could tell you both from a personal experience as a fellow, and then also as faculty, and what I've witnessed with the fellows. So for me, I was coming into the fellowship right after finishing residency, and my biggest concern was that big drop off that might happen going from newly minted attending physician to practicing relatively minimal during the time of the fellowship, and then what that transition would look like. And so again, similar to what Kareem was saying, talked with Dr. Reed, talked about options and availability. Fortunately for me as an emergency medicine physician with shifts being shift work, I was able to adjust accordingly. And so I worked nights and weekends in order to figure out time to get my clinical experience while doing the fellowship, understanding that the fellowship was a large time commitment with both attending classes, especially during the summer sessions where you're essentially a full-time student, and then also transitioning into the fall semester where the course load tends to be a little bit heavier. There are some other fellowship requirements that Dr. Reed mentioned, including some travel and whatnot, which may complicate your ability to work clinically. And so I think the reality is when I see fellows and what they do is they try and negotiate time between their downtime during the fellowship, whether it's the winter break from the School of Public Health or some other downtime during the course of the year to engage in some clinical practice. That being said, I think when you do this fellowship, you really need to make sure that you invest this time in this year to really advance yourself and focus on the clinical, not focusing on clinical practice, but really thinking about those next steps in your career and how you transition from a clinician caring for patients to think about the policies that are impacting the patients that you're caring for.
Thank you. Some of the other questions have come in are related to sort of background in terms of disciplines or specialty kind of training. Also questions about individuals who are coming into the fellowship who may be at different points in their career. I'm going to answer two of them together. This is really about if you are a physician and you are board eligible or board certified, then you're eligible to apply for the program. You need to be a U.S. citizen or a permanent resident. And we look across disciplines. People are coming in multiple years from new disciplines. And so we don't screen out for that. We're really looking for leadership potential, and commitment to vulnerable populations. I would say, to just reinforce, the fellowship is a time for you. It's a time for you to reflect, to take a break. For most of us, we run from college to medical school to residency to fellowship. We're just running. And we don't really have that time to step back and say, what am I doing? Why am I doing it? What do I want to do? What are my values? Where do I want to take my career? The fellowship is a time to do that. And if you pack it in so much with doing all clinical that you don't take that time for reflection, you don't take that time to build the networks and this sense of community and this sense of camaraderie, the real fellowship of the fellowship, then you lose out on a whole part of it. The fellowship is not about how do you just pay for a degree. It is so much more than that. And so taking that time for yourself, which sometimes can feel hard, is so important during the course of this year. With all of that in mind, though, several people asked questions about, with the pandemic, how have things shifted or changed? And Kareem, maybe you can talk a little bit about how it shifted for now. And Alden, I think maybe you could talk a little bit about how it shifted as a faculty member, but also with the pandemic, the ways in which you or Mary, the ways in which alumni have joined in and some of the things that have been going on with alums of the program. So Kareem?
Absolutely. So I think from the school perspective, and really everything has moved virtual this spring. So the summer MPH term, the fall MPH term, in terms of all classes through the School of Public Health, are 100% virtual. They haven't made a formal announcement about the spring. I think they're waiting to see what the numbers look like in this area. But the nice thing, I think one of the richest pieces about the fellowship is really kind of creating those mentorships, creating those connections. And I think in some ways, we're still getting those chances because these leadership seminars are still happening, and we're still kind of like in a group of just little Zoom squares, which isn't as cool as kind of being around a boardroom table, maybe having an intimate conversation, but it's still a very intimate environment that you are able to create connection. That being said, it is different. So we're having to kind of be creative about how our fellow class is, getting together in a manner that feels safe. And so I think everyone's doing their best. And I still feel like I've had a chance to connect with my peers, which is the most important piece.
And part of the fellowship of last year's cohort was also impacted by COVID when we had to shut down campus prematurely in March. And so for those individuals who were doing the fellowship then, we converted a lot of their experiences to virtual, including their site visits. And although it wasn't as smooth as it is going to be this year, it was still well received, and they were able to interact with individuals down in DC at the various organizations there that we typically partner with. And so I think that as we become more adaptive with Zoom and these interactive platforms that are allowing for these virtual interactions, the goal is to maintain the same quality of the interactions that and experiences for the fellows, understanding that they may be done more virtually as opposed to in person.
Thank you.
And I'll just chime in. I think one of the specific questions is kind of how your practicum experience might be different in light of this. And so I just wanted to touch on that. I think, obviously, in the past, you might have had more in-person interactions with more kind of local or Boston-based organizations to work with. But in some ways, this is nicer because it's kind of broadened the field of projects or possibilities of who you can work with, because everything is virtual. So you don't necessarily have to, be close to the organization to get down there for meetings and things like that, because our world is operating differently right now. So I see some of my peers kind of exploring opportunities that might not have actually been available otherwise.
I think to that, from the practicum, lots of things are done locally because Boston is such a rich environment of opportunity. But fellows have done practicums from Seattle to California to Florida, really across the country based on their interests, where they want to go next, and the kind of connections and interests that they have. There's some other questions about where people are in their careers. And you heard here, some have come here straight from residency. Some have come here from a fellowship to the program. Some of individuals who have been out in practice and then private practice and come back in. Some are individuals who have been assistant and even associate professors. I'm thinking of one person who left the fellowship and became a department chair. So it really is across the board in terms of where people are in their careers. And it's more about where they are in their life course and how prepared they are to maybe pivot or change. How sometimes they're frustrated they are with the system and they want to change the system and they want to be in a place to learn how to change the system. But we have no preconceived notions about where you should be in terms of from having completed that residency and being board eligible, board certified, up through having years of practice. And they have done amazing things across the board. That has not restricted the kind of things that they have been able to do. I'm also asked about, will the 21-22 be virtual? And I don't know. Karina's already told you that we're not even sure if the spring is going to be virtual. My sense is it probably will be because of where we are in the world, but it's not, Harvard has not said yet, and we operate our schedule based on the university. And Harvard has not yet said what's going to happen with our spring courses. And we don't know what's going to happen with the pandemic, so I can't tell you if it will be virtual. The fellows have done a superb job, even virtual. And so Dr. Landry talked about, of the courses for the school, a good chunk of them are actually taken during the summer and gotten out of the way to free fellows up during the academic year. And so, Karina, is it fair to say it's a thick summer?
Indeed. Let's just say it's a transition, as many of at least my cohort class hadn't had the experience of sitting down and being in a full-time Zoom class, Zoom world, Zoom curriculum, Zoom university, whatever we want to call it. Was a transition, but it was really nice when it came to picking out fall courses to know we already had all those credits under our belt.
Some of the other questions that are showing up in the Zoom of the stipend and benefits, the stipend is $60,000 plus full tuition. paid, and health insurance for individual. We don't cover family health insurance. Another question is, will people have to be here? Because the course, the fellowship is an in-person fellowship. It's not done from distance and distance learning. And is there a plan to change the structure of the fellowship? There is no plan at present to change the structure of the fellowship. I think the current fellows have done an amazing job of building community, and others working with them to build community, even though it's virtual. But there's still a part that is missed by not interacting personally. And maybe a little bit of that and a feel for that, maybe Alden or Mary, you could speak to that component of the personal connection from what you had, and Corinne, from what you wish you had for this year.
I'll let you go first, Mary.
Well, thank you, Alden. I would say, well, just to kind of give you a kind of a snapshot of my particular class, and some people are asking about, especially the social aspect. I was one of those who did no clinical work for the year, and I loved it. I was glad for the break. Wouldn't have done it another way. It allowed me to completely focus on the fellowship work, and I did not feel like I lost any steps going back to clinical work after the year. So I'm an OBGYN. And, you know, in order to be board certified, we have to do clinical work for at least a year to two, depending on when you take your boards. So that was important for me to finish that, but I don't feel like that put me behind in any type of way. My classmates ran the gamut. So some people traveled with their family, so with their spouses, with their kids. One of my classmates was bi-coastal, so her husband was on the West Coast, and he would come at least once a month to visit. And then, you know, some people take leaves from their job, and one of my classmates took a leave and came with his family and went back to the same job. So I think you can make it work if you build the space in your life. You can make it work no matter what your social situation is. And then I think, you know, for me, one of the biggest things was the connections that I made with my classmates. We still are in contact. We still socialize. Pre-COVID, I saw a couple of them last year, the two that are in California. Actually, there are three in California, aren't they? But I saw two of them in California last year. And then one is back on the East Coast, and we talked last month. So we stay in contact. Alden and I talk all the time as well. So it is truly a family, and the social support doesn't stop, after the year. And
just to add to what Mary was saying, one of the things that's really important about the fellowship and the community that you build with your classmates, as well as with the other fellows from other years, it's very easy for us to link each other to opportunities, and it happens all the time within the fellowship during the year when we're in these meetings and we're talking to individuals. Because we know each other so well, we know each other's areas of interest, we're able to say, oh, this is your area of interest, and this individual who is a leader in this space is over there. Let's go and chat with them together. Or when we're post-fellowship and there's job opportunities that are coming up within our organizations, we share that information as a larger network to help promote each other for new opportunities. And so I think that is something, again, just a uniquely rich experience that you will get as being a part of this fellowship. And just to dovetail another point that Mary said, people are coming from different spaces. The expectation isn't that you come in and you understand policy and you're ready to, be that change. This is a time where you can be cultivated, and that's what Dr. Reed has carved out this space for. So you can be groomed and educated and refined, and all of those other words that go along with helping you to advance yourself. People who come to this space are coming from various points in their careers. And a lot of times individuals come in with the expectation that they're going to go right back to the place that they're at. But after 4, 5, 6 months in the fellowship, they realize that their career is actually better suited. Their career trajectory is going to take them in a different space, and they're better suited if they were to leave that job that they were originally in. And there's a lot of aha moments that happen during the course of the fellowship that many of us experience along the way.
I want to thank you for that. So I'm hoping that part of what you're hearing is there is not a preconceived notion about you should be in one kind of specialty or another. There's not a preconceived notion about you have this kind of job when you end, or you should work in this kind of sector. Or that when you come with your family, or you don't, or you do clinical and you don't. The fellowship is really geared around you personally, around where you are, what your needs are, and how we can help you to get to where you want to go in the next stage. And so it's a commitment from a fellowship. It's a commitment from Commonwealth Fund that has supported us all along, and an understanding that if you looked at the slides that Dr. Zephyrin showed from the beginning, there is a need for diversity, and there is a need for leadership that attends to the issues of vulnerable populations everywhere. And so we need fellows who leave this program and populate multiple spaces and have representation in multiple spaces. And it's got to be the space that's right for you in your career and where you want to go. So we are at the end of time, or just about at the end of time. There are some poll questions. Please stay on and answer those poll questions. I want to thank everybody who has been on this, Dr. Zephyrin, Dr. Davia, Dr. Fleming, Dr. Landry. Thank you for giving your time today. For everyone who has joined us for this session, I thank you too. Please visit our website or call or email us if you have other questions. Thank you.